Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy You, Healthy Nation, Healthy World. I'm Nancy Valentine. My background is PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And our shows are really going to help you navigate the healthcare system more effectively, as well as take care of yourself more effectively. And to that end, we have 2 wonderful guests today who I will introduce in a moment. Our topic is on patient advocacy, and the title of our topic today is Effectively Communicating with Family Caregivers, Family and Patient-Centered Care at the Hospital of the University of Pennsylvania. And our 2 guests today who are going to really educate us on what that means and how you as a consumer can be more effective in your care when you happen to be in the hospital is first Mary Walton to my left. Mary is a nurse ethicist at the Hospital of the University of Pennsylvania, and she has practiced in academic healthcare settings for over 35 years and has a progressive history of leadership, as you will hear about this today. Her role with staff has been to be a clinical nurse specialist and nurse manager. She is involved with clinical ethics committees, which she will tell you about. Currently, she is responsible for organizational initiatives focused on clinical ethics and improving the patient and family experience of care, which is really our focus today. And to that end, we've really asked a person who was involved as a family caregiver, our consumer Anita McGinn-Natali. Anita has a phenomenal background. She is a person who grew up in the Philadelphia suburban area and studied at Temple's Tyler School of Art. And she is a practicing fine arts oil painter and has her own studio in this area. She will be talking about her own personal experience that came, like many of these, out of the blue, and how she was supported by the program at the Hospital of the University of Pennsylvania. So let me start by just reading an excerpt from her background with this experience. In 2004, she had started her studio and she was really blooming as an artist. And then just a few years later, her husband was diagnosed with oral cancer and she immediately got thrust into the role of becoming his caregiver and advocate, a role that no doubt she embraced, but nonetheless, it was a new role, certainly not the same as being an artist at home. Her husband had a resection from ear to ear due to his cancer, a tracheostomy, and a free flap from his thigh for reconstruction during his initial hospitalization. He received his nutrition and medications from a nasogastric tube. The nursing staff, though, really helped her tremendously. They encouraged and taught her how to clean and suction the trach, administer medications and tube feedings, manage the wound care, observe and recognize the changes, and know when to call for help. She felt included in an integral part of his care. Now, the question is, how did that all happen? And it's really not magic. It really has to do with the work that Mary and her colleagues and team developed. And Mary has started this very, very impressive patient and family-centered care organizational model at Penn, and she's going to tell us about that. And then we're going to hear from Anita how that work really helped her in her care with the nursing staff. Mary, welcome.
Thank you. I'm happy to be here. This is such an important topic. So I can start by telling you that here at the Hospital University of Pennsylvania, we have really tried to strengthen and improve the experience of care for patients and their families. So a number of years ago, our Chief Nursing Officer, Victoria Rich, really launched an initiative that the organization embraced, which we called our Patient and Family-Centered Care Initiative. And as part of that, we really had to look at how do we encourage families to be present and support patients and to participate in care. And as part of that work, we knew we needed to establish a group of what we term patient and family advisors. Mm-hmm. So this is a special volunteer role of individuals who've had experience with our healthcare system, believe that we have cared for them well, but recognize that there's always room for improvement. and they're very committed to our organization and to improving the quality of care. So we established a very specific volunteer role for individuals who had experience and asked them to join with us, to work with us in partnership at every level of the organization. So not only at the individual bedside, but to be as part of members of work groups, teams, and committees. And that is evolving. We've had the advisor group established for 2 years now, and they're really coming into their own in terms of getting involved in all sorts of ways in the organization.
That's very impressive. Now, Anita did not start out as a volunteer. She started out as the wife of a very sick individual. And Anita, tell us how that occurred in your life.
Well, I guess I use that experience. It was such a sidelining experience for both of us. We were thrust into the medical system and into a very foreign, for us, territory, which I think for a lot of patients that's what happens.
Absolutely.
So it's knowing how to navigate through that system and who to talk to, who to ask questions of, that is so important. I learned a lot through that experience. Well, the one thing I will say is in his initial hospitalizations, he's had many of them, but in his initial hospitalization, I was encouraged to be a part of his healthcare team, which for me was far better than just being an observer. I'm a hands-on person, so I really enjoyed being asked to participate. I remember one example. He had just come up onto the floor, and the nurse had cleaned him up. He looked very good, but he needed something on his lips. His lips were chapped. And I remember her putting I guess it was like a Vaseline or some petroleum jelly on his finger, and she said, gently guide his hand up to his mouth because we want him to take ownership of some of his care as well. It was such a little thing, but a huge step. And it made me realize how important it is that I partner with him on this. I remember staying in his room that first night, all night long. And they set up a little bed for me so that I could sleep. And I remember getting into bed and he started coughing. I hopped out of bed, put my gloves on, tidied up whatever that was, went back into my little nest. This went on all night long, and I realized, you know what, you're not going to sleep tonight. And it doesn't really matter. Just be there for him. He knows you're here. He knew I was there by my touch. He wasn't able to communicate with me, and I think he was a little bit still under the influence of some powerful pharmaceuticals, but he was able to acknowledge that I was there with him by just touching.
Right.
It was very very huge event in our lives. I'm so happy that I could have been there to support him.
Right. But the interaction, as you said, as small as it may have seemed at the time, was really the nurse helping you to really start to assume some care.
Exactly.
That you would then, travel home with some of the same knowledge and same expectation of what would your role be in helping him and how to help him be as independent as possible, even in a very desperate situation.
In fact, that's an interesting point. There is, because I assumed so much of his care, I do remember a pivotal point at home where he started assuming his care on his own. And it sort of threw me back a little bit. I wasn't sure he was ready. And he was ready because he was assuming. But, it was kind of a tough choice for me to back off a little bit because I had been so active up until that point. But I think we came through great, and I encourage other people to get involved. I loved being a part of the team. I loved when the nurses and doctors were doing rounds, and they would come in and they addressed me as well as my husband. That's really important because you are a part of your loved one's
right
situation.
And I think what Mary's telling us is that's really the philosophy that comes out of the center. So the philosophy is really embedded in the whole organization. So it wouldn't be like if you had one unit that you went to, they would do this, but if you went to a different unit, maybe a medical surgical unit in another wing of the hospital, they wouldn't necessarily do that. But in this case, because of the center and the work that has been done by Mary and her colleagues, everyone subscribes to this because obviously the staff see some value in this. Can you speak to that?
Imagine, if we really think about the patient's perspective coming in and having major surgery, such as Anita's husband had, thinking about how vulnerable, how scary, pain, being in that situation, as much as nurses and physicians and the whole team care and bring all that knowledge and skill to the bedside, can't we all imagine that we might want a caring loved one there who can comfort us, touch us? We know that they're watching out for us, and that really strengthens the care of the team, having a family member at the bedside. And again, for the patient's perspective, but we really think about the patient's experience being the center of what we do. If a patient would want a family member with them, that's really important, that they're present and that we work with them and we share all our knowledge and skill. And that really sets the stage for a safe transition to home. And given the nature of what's happening in our country, where individuals are living longer and longer and managing very complex chronic conditions, we want individuals and their loved ones to build that skill to learn how to manage it and live their life at home.
You know, let's speak about, being a member of the team. How did you experience that personally? I mean, other than you've said already that it was very empowering, it made you feel important, but in terms of your own anxiety in the face of such a serious illness of your spouse, how do you think it helped you personally?
Oh, I think it was a remarkable stress reliever to a degree. There's a lot of stress, of course, when your loved one's in the hospital. I think when you're involved, instead of, again, being an observer, I think it definitely helped settle my stress and level my stress quite a bit, because I'm actively participating. I can't have, that's kind of it for me. I think if I'm just an observer, I can go through all kinds of things in my head. What's going on? Why is this? Why are they doing that? If you're involved, you already have an understanding because they're teaching you. You know, the nurses were very good at describing and teaching me, guiding me on how to do things with a lot of encouragement. I wasn't doing complicated medical procedures, but there were things that I would have to learn in the hospital to do when I went home, particularly the trach care, which was so scary.
Right.
When you build up a certain level of confidence, and my husband had trust in me that I could do it. And I remember being terrified, and I would look at him and say, "Are you okay? Am I hurting you?" He shook his head, "No." I knew I could go on, and I kept on going on. It's uncharted territory, but when you have the support of the nursing staff guiding you and teaching you and patting on the back and cheering you on, there were cheerleaders too, perfect cheerleaders. That feels really good and gives you a boost that, yeah, I can do this.
Right.
I would imagine feeling helpless is a terrible feeling, and when you're at the bedside of someone. So again, knowing that there's something you can do to help your husband is part of that. Again, feeling helpless is a terrible feeling in light of a loved one's illness.
The other thing I think that is important for families members getting involved in their loved one's care, or just being there anyway, supporting them, I think my husband's stress level was also relieved significantly because of that. I remember in a couple of days just after surgery, his stress level was very high, and as things started to settle down and he was aware that I was with him, he became a lot calmer and more willing to participate or, cooperate, I would say. I think that's really important because stress can hold you back from healing.
Right. So we're really talking about not just the physical moments of doing some basic care and learning how to do it and building some confidence, but we're also talking about the psychosocial, the stress, the sense of being involved, part of the team, which is really extremely critical as well, because that is also transportable when a person goes home. They need to be part of a new team, maybe other extended family members, maybe the nurse who's coming in from a home-based agency to really help and support the care. So what happens initially in acute care settings really does travel home, so to speak.
It does. It does.
So obviously things worked out. Your husband got discharged. It sounds like he's doing very well, which is marvelous.
Back to golfing.
Back to golfing. After that kind of surgery, that is remarkable.
We're very lucky.
You're very
I feel
fortunate.
very grateful to the staff at the University of Pennsylvania, Hospital of University of Pennsylvania. I don't think we could have done it without them.
Well, it's a team effort, right? It's a full team. But then what happened after you came home, after things started to get better and things settled down, then there must have been a second chapter to this.
There is. About a year ago, I said to my husband, I would love to volunteer at the hospital. I said, are you open to me doing that? Do you feel like we're at a point in your care that I can do that? And he goes, absolutely, go for it. So I applied to the Volunteer Services Department, and Donna Griffith introduced me to Mary Walton, and Mary invited me to be part of this Patient Family Centered Care Advisory Group, which has been wonderful. I've met wonderful people, but it is interesting how the perspective of a caregiver does differ from the perspective of a nurse or a clinician. And I found that they've been very appreciative of hearing from my side of things. And it's been great. I really love what I do. I volunteer once a week now, and in addition to being on the committee, and it's just been great.
I think our viewers would really enjoy hearing about the committee, like the nuts and bolts of it. How does it really work? Who's on it? You know, what are the topics? How do you take assignments? Just give us a little more.
Do you want to talk about that?
Well, first
Outline.
I'll mention Donna Griffith is our Director of Volunteer Services at the hospital, and we have, I think, 1,000 volunteers. So Donna Griffith interviews folks who, you know, are interested in volunteering in some capacity. And then she often thinks there's some folks like Anita who really have a passion for helping and want an opportunity to help in new ways. So I interview folks who are interested in this specific role, which is patient or family advisor. And we have about 20 advisors now. We're building that group of individuals. Okay. And they formed a council. We expect to have more and more volunteers, but right now it's primarily our advisors. And then we have members, our Chief Operating Officer, Mr. Al Black, Victoria Rich, our Chief Nursing Officer, representatives from pharmacy, from medicine, from a number of other disciplines, from social work, are on that council, but the majority of the members are patient and family advisors. And we have a process where department heads, really any individual in the hospital can request time on the agenda or request time of an advisor to help them with a work group or a project or to join a committee.
That's interesting. Now, typically, what kinds of topics come up that would be like a good match for that?
Well, the very first project, if we think about the hierarchy of needs, and this was, I think, before you actually joined the council, was looking at food. Dietary Services said we know there's always opportunities for improving food in the hospital, and they wanted to launch a new menu. And so they asked for some advisors to participate, and they set up some menu tasting and had a whole session with the chef where the advisors sampled food. It was brought in just as if you were a patient in your inpatient room and tested it. They also got involved in looking at the unit kitchens with following the trays around and looking at how the temperature of the food was on arrival to the unit. So they really partnered with food services and gave a lot of feedback about what they thought was good and what they thought could be better. We had another project where missing belongings is always something that comes up in the hospital, particularly when patients move around. And we had a couple advisors who really championed, we have to improve this. It's very difficult if you lose your glasses or your dentures or your hearing aids. And they met with every single unit in the hospital and the emergency department and talked about what are the issues in this area, why are patients' belongings going missing, and what are new ways to prevent this. And as a result of that work, which probably took 8 or 9 months, we had a dramatic decrease in the loss of patient belongings. So they were some of the earlier
So basically,
projects.
the food was better and people had their teeth to eat it.
Well, very important.
I mean, really, this is not a small item when you're in the hospital.
Yeah.
Right?
And you think about, we offer so much intensive, aggressive care, but these things matters too, the food and et cetera. So, it really affects the patient experience.
Right. Well, what's interesting is that projects such as the two that you just mentioned are often referred to as process improvement. And hospitals across the land are really very focused on process improvement because as an industry, we recognize that we really have to get better. We may not be the Ritz-Carlton in every hospital, but some of those same principles apply. And so that's why, you know, the work that you're doing is very important. And people like Anita and others can really see it, as you said, from a different perspective. Anita, in terms of your work, what have you gotten involved in?
I'm actually currently involved in a project that is tracking patient satisfaction. So when you're a patient in the hospital, we are offering patients a venue for them to express comments regarding any issues that may come up that are of a non-medical status. So it could be something like the hallway is very noisy at night. That's actually a common comment. It's a way for the patient to address something that the staff can jump on and fix very quickly. Now the noise in the hallway is probably a little challenging, but there are other issues that come up that patients, I see it happening all the time. I'm taking notes, I'm entering these notes onto an iPod as they're speaking to me. That information goes right to the nurse's station, and the nurse manager is reviewing the comments. If it's something they can handle right away, they do. And I've seen it in action. It's been wonderful. I left a patient's room the other day, and the nurse manager was coming down to correct an issue on that patient's room. So it is working, and patients love that they're being asked to comment.
Right.
They love it.
Right. I don't think it's an easy issue to decrease noise in the hallways.
It's not.
So did you actually succeed in that?
Well, there are a number of initiatives, I think, actually, that they're investigating, and I when they give me that comment, I'll say, we're going to do our best tonight, but that may take a little longer for the hospital to correct, because you don't want to give them false hope that tonight's going to be super quiet, because I can't do that. But to acknowledge to them that we're aware of your concern, and we hear this a lot, and we're working on it. They like knowing that as well.
Right.
They feel appreciated, that their opinion counts.
Right.
Yeah, another way advisors are supporting this change and improving in the experience is thinking Anita and two of our other advisors presented to a group of probably about 100 nurse leaders, where I interviewed them, and they talked about their experiences, and one was around noise. So this idea of constantly exposing hospital staff to the perspective of patients and families. So we call them story forums, but talking about what does it feel like when you hear noise at night, and whether you're the patient sleeping or you're with a family member. Because we forget, you know, people are talking, there may be something going on with another patient, and what can we do so that we keep the immediate patient care environment quiet. And getting exposure to that, being constantly reminded of the patient experience, we know can improve things. And again, noise is one of many things we're really trying to focus on, and know that there's opportunities to improve.
So one of the feedback loops for the staff to really understand is this story forum. Can you give us an example of a story?
We had an advisor and his spouse, who's a family caregiver. I had a luncheon with some of the environmental services staff, a very small group. And they're not staff that often get to feel that important, even though their work is important. And this particular advisor is a transplant recipient. And you know, he's very articulate about how his life has been saved. But he constantly worries about infection, and knows he has to be very vigilant. So when he comes back for his appointments, the environment and cleanliness is very important. So these two advisors talked with about 12 environmental service employees about how important it is to them that the bathrooms are clean and the hallways are clean. And it was really, it was a very moving experience, because they said, you know, we just never thought about it that way. And as a way to give more meaning to their work, and also understanding. It was interesting, some of the staff said, we knew oncology patients are really worried about that, but we never sort of thought about all the transplant recipients around our organization. Now, what we hope is that when they walk out of that room, that they have, again, an added sense of, my work really matters. And, you know, everybody's job in a hospital matters in terms of making a safe high quality experience for patients.
Right.
You know, from the surgeon to the person that makes sure the environment is clean.
Absolutely. It's really a circle rather than, you know, an hierarchy. You know, really everybody plays a role in this. But back to the patient satisfaction, have the scores improved since this program went into effect?
The program is actually a pilot program, started in the beginning of November, and it is concluding this Saturday, the 2nd. I think they're going to take all the data that they received, and there were quite a few services, units that were participating, but not the whole hospital yet. So they're going to take that and I think review it and then go ahead and expand it to the rest of the hospital eventually. That's the hope.
Okay.
Now,
Now,
it's one of many strategies that
Yes.
we're doing around patient satisfaction.
Right, right. But this is the one that really gets the advisors involved by going out and talking with
Well,
the,
this
with
is one
the
of
patients.
no, I would say there's others. This
Yeah,
is,
there are
yeah.
a lot of them, many of them. Trying to think.
You were actually last evening meeting with some of our residents, our physician staff, around orientation for patients.
Hospital-wide orientation, yes, that's going to be adopted, and they're working on a project now to provide a program, a video perhaps, that will be accessible to patients and their families once they come into the hospital.
I see.
But house staff, physicians in training
Right.
are working with advisors and listening to their what they think is important.
That's good. And what kind of reception did you get from the residents?
Oh, excellent. They're great. Yeah, it was. They were very warmly received, and they were very open to listening. It was myself and another advisor who attended the meeting last night, and they were very open to our suggestions. It was very, very, really, cooperation is so important.
Right.
And
I've had about 4 requests in the last couple months from researchers putting together grants who would like to have an advisor as part of the planning and the grant
That's
development.
wonderful.
Again, recognizing the importance, if it's all about improving patient outcomes,
Right.
how do we bring that perspective as we plan and study how to improve?
Right. Now, you as one advisor, do you get together with the other advisors? You said there are approximately 20. Do you get to know some of the other advisors
absolutely,
in this work?
absolutely. In fact, I've formed some great friendships already,
great.
and it's been wonderful.
Yeah.
Everyone brings their own experience to the table, and it's very interesting to hear everyone's history. You know, what brought them there, and what they're involved in today, and I love it. I love it. I feel very fortunate to have met so many
Would you
wonderful
say
people.
that there are any themes when people do talk about what brought them to these roles? Would you say there's any common
Yes.
theme?
Common theme is I want to give back. I hear that all the time. I'm here because I want to give back. I appreciate what was done for me, or appreciate what was done for my husband or my wife. That is a common theme.
Right. That's wonderful. So there are many ways to give back. I mean, sometimes it's through philanthropy. Sometimes it's other ways of volunteering. But this is so patient-centric. Hence, you know, it's all part of the family-centered approach that's being used. So what would be your closing remarks and advice to our audience in terms of people either becoming advisors or knowing that the hospitals that they are going to as patients have this kind of input?
Well, I would say, as a caregiver, I would just say to speak up and ask questions. It's not always apparent that the facility you're going to has a program in place. So not knowing that they do or not, I would say just be willing to speak up and be your own advocate, or an advocate for your loved one. And don't be afraid to ask questions. I think that's the only way you're going to learn and move forward and feel comfortable.
Any further advice you would have?
No, I would add, if an organization doesn't have an advisory council, just as Anita said, your first step is speaking up and being a full participant for the individual's care, whether it's your own or your family member, and recognizing that you're a crucial member of the team. And so, at least on the individual's care, I want to be a participant.
Well, thank you both. It's been a really, really interesting discussion, and I think for our listeners, it really is about you. And I think, Anita, speak up and get answers, and expect to get them, and expect to be part of the team. You're as important as everyone else. Thank you very much for listening.
I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.